Hi, it's Lauri Kane from the Baltimore Plastic Surgery Office of Dr. Dean Kane. A lot of patients always ask, which is they should, is, how long will it take to recover? Whether it's a facelift, whether it's a breast lift, a breast aug, a tummy tuck. Well, tummy tuck's a little different. But in terms of general recovery, there is always that, we always say generally it's going to take 2 to 3 weeks. Well, why is it 2 to 3 weeks? Well, I'm going to explain that right now. So Dean actually was a wound expert in his junior years. He actually wrote chapters on wound healing. And this actually came from one of his chapters in his book. And so he's really very up on why people recover the way they do. So, and also, it also explains why after 2 or 3 weeks you get feeling like it's getting tighter after surgery, you're getting lumps and bumps. So there's reasons why that happens, and it doesn't matter what kind of surgery you do. So whether it's a facelift, a neck lift, a breast aug, a tummy tuck, liposuction, it all recovers in the same way, and here's why. So on day 1 of your surgery, this line is swelling, it's edema. So on the first day, you're gonna have your maximum swelling. And then over time, now this is 1 week, 2 weeks, 3 weeks, 6 weeks, 3 months. And you can see that over time, the swelling does go down, 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 down. And the other reason why we say generally it takes almost a year to be fully recovered is because it truly takes the body, depending upon what level of surgery you're having, a lot of time for the swelling to go down. At the same time, the body is developing scar formation. Now, scarring is good, so don't think of scarring as negative. Scarring is like the glue, like when you have a facelift or your breast aug, it's the scarring that holds the implants in place. It's the scarring that keeps the face firm and tight. It's the scarring of the tummy tuck that gives you a nice flat, solid, flat tummy. So we need scarring. Scarring is crucial. So scarring, however, as you can see at the bottom, we have 0 scarring when we first start surgery on the day of surgery. After 2 weeks, you could see that hardly any scarring is available to your body. But yet at that 2-week mark, which is when sutures dissolve, you're kind of at your most vulnerable part. And yet at the same time, at 2 weeks, you're feeling great. You're in no more pain. You're ready to get up and go to work, get back to exercising because you're feeling really good. And actually, this is when people get into trouble. They get into trouble at that 2-week mark because you're feeling good, you're doing a lot more, you're washing, you're doing laundry, you're cooking, you're cleaning, you're going back to work, you're driving. And so all of a sudden at 2 weeks, you have very little scar formation. So what's holding you together? Your sutures have dissolved, so you are very vulnerable for those scars to open. And so that is the problem. So we tell our patients, really, once you get past that 3-week mark, you're getting into the safer zone of making sure that your sutures stay together well, but you're still not out of the clear. And so over time, you can see that the scar formation increases. At 6 weeks, it's increasing. And so the body keeps laying down scarring over time. And when it does that, it doesn't lay it down smoothly. It actually lays it down in lumps and bumps. And so that's why, especially after liposuction, or even no matter what surgery, you feel like you don't see them, but you kind of generally feel this irregularity under the skin. And that's your scar formation developing. And then what happens is your body says, okay, I've laid down enough scar, and that's when you feel your tightest and your firmest and your lumpiest and your bumpiest. And then the body says, okay, we can soften that scar tissue. And at that point, at the 3-month mark, that's when your body says, okay, I'm gonna relax that scarring, and it gets smoother and softer, and therefore it almost takes a year for scar tissue to smooth out to a point where it feels smooth. And for that reason, we always tell patients, especially on a facelift case, if you have a special event and you're planning a facelift, really, you should give yourself no less than 6 months, to be ready for that event. Because as you can see, you're developing all that tightness, firmness, and then at that 3-month mark is when your face finally gets very soft and natural looking, and then it just keeps looking natural and natural by a year. So that is your recovery chart, and it's very important to understand why to take it easy between 2 to 3 and 4 weeks. All right, we're always available for you. If you want any particular type of surgery, Dr. Kane is the best around. Call us at 410-602-3322.